advancement in treatment, investigations, and much more. My sadar namaskar to all the dignitaries, and I would like to acknowledge them serially. First, I welcome National NIMA Women's Forum, immediate past president and founder of Women's Forum, an accomplished person, Dr. Sadhna Kulkarni ma'am. National NIMA Women's Forum influential president, Dr. Vaishali Padgan ma'am. National NIMA Women's Forum dynamic secretary, Dr. Mrunmayee Masotkar ma'am. National NIMA Women's Forum empowered treasurer, Dr. Rashmi Sharma ma'am. Maharashtra State NIMA Women's Forum immediate past president and esteemed personality, Dr. Sapna Jagdade madam. Maharashtra State NIMA Women's Forum proficient president, Dr. Anushri Mundewadi madam. Maharashtra State NIMA Women's Forum inspirational secretary, a very well known Dr. Pradnya Shirke madam. Maharashtra State NIMA Women's Forum visionary treasurer, Dr. Meenakshi Saratkar ma'am. Maharashtra State NIMA Women's Forum confident coordinator, Dr. Pallavi Mani madam. Maharashtra State very techno-savvy technical team headed by Dr. Shilpa Korane madam, Dr. Daga sir, and Dr. Joshi sir. Our today's charismatic speaker, Dr. Swati Mohite madam. My dear friends, NIMA Women's Forum Maharashtra is working under the leadership of President Dr. Anushri Mundewadi madam, Secretary Dr. Pradnya Shirke madam, and Treasurer Dr. Meenakshi Gawal madam. Dear friends, we conduct various programs and activities at branch level and state level. Technical team, I would ask to mute all.
Shimla ma'am, you unmute yourself. Huh?
Till now, I was audible?
Yes, you are audible.
Okay. Till now?
Yes.
Okay. My dear friends, NIMA Women's Forum Maharashtra is working under the leadership of President Dr. Anushri Mundewadi madam, Secretary Dr. Pradnya Shirke ma'am, and Treasurer Dr. Meenakshi Gawal madam. Dear friends, we conduct various programs and activities at branch level and state level too, which includes academic fest, sports, social and cultural activities on large scale. In academics, we conduct various CMEs, seminars, webinars to upgrade our members' knowledge. In sports, we conduct cricket tournament at branch and state level. Also, we encourage marathons. In social activities, we conduct various health camps, awareness programs like menstrual awareness, HIV awareness, sex awareness, sex education, breastfeeding awareness, and much more. We also believe in conservation of nature and conduct tree plantation programs. NIMA Women's Forum had helped in various natural calamities like flood and pandemics also. In cultural activity, we conduct annual functions and gathering, fashion shows, dandiya, and Mangala Gaur. Also, NIMA Women's Forum conduct trips at local and state level. Last year, we went to Goa. This year, we have already planned to Kutch, Gujarat in January. Thus, we help our members to develop in all fields along with their medical practice. We have conducted 250 plus activities in this new tenure, which has started just from the May. Till date, we have completed 250 plus activities. This grand webinar IE is also a part of academic activity of state level, for which we got tremendous response from all over India. We have about 420 plus registrations across India and some from abroad also. So now NIMA Women's Forum Maharashtra is not only national, it is going to be an international organization also. NIMA Women's Forum subject is very vast, but time flies fast. तो आइए कुछ काम विशेष करते हैं, रोशन गली मोहल्ला और देश करते हैं और भगवान धन्वंतरी की आराधना से इस वेबिनार की शुरुआत करते हैं. I would request to Dr. Shilpa Korane ma'am and technical team to play the Dhanvantari Stavan for all of us. Dr. Shilpa Korane ma'am,
Yes, ma'am. 1 minute.
तरी स्तवन नमामि धन्वन्तरिमादिदेव सुरासुरै वन्दितपादपद्मम् लोके जरारुका भयमृत्युनाशनम् दातारमीशं विविधौषधीनां शङ्खं चक्रं जलौका दधदमृतघटम् चारुदौर्भिश्चतुर्भिः सूक्ष्मस्वच्छादिरुद्रम् अंशुकपरिविलसन् मौलिमं भोजनेत्रं कालाम्भोज्वलाङ्गं कटितटविला सच्चारुपीताम्बराढ्यं वन्दे धन्वन्तरिं त्वं निखिलगदवना प्रौढदावाग्निलीलम् प्रौढदावाग्निलीलम्.
Thank you, technical team. We now really feel blessed after Stavan. I would now like to introduce our knowledgeable chairperson, Dr. Rajesh Utane sir, and multifaceted co-chairperson, Dr. Pradnya Shirke ma'am. Dr. Rajesh Utane sir runs Dr. Utane Fertility Clinic at Amravati. Sir has done his MS in Art and Embryology in Spain. He is a BMS graduate. He has completed his DGO in Ayurveda at Pune, CCRG in Reproduction and Genetics. He has 25 years experience as consultant in infertility and eugenist. Sir has various affiliations. He is a national coordinator, NIMA Obstetric and Gynec Society, President NIMA Fertility Society, ex-executive member MCIM, ex-president NIMA Amravati branch, President Dr. Utane Foundation. He has been interviewed by various newspapers and also by All India Radio. He has published various research papers. He has also received gold medal for infertility in Calcutta. He has also bagged International Panacea Award at Bangkok. Our multifaceted co-chairperson, Dr. Pradnya Shirke ma'am, is a BAMS and MS in Prasuti Tantra and Stri Rog and a PhD scholar. She is consultant gynecologist at Shirke Hospital and Maternity Home, Chinchwad, Pune since last 22 years. She is professor at Dr. D.Y. Patil College of Ayurveda and Research Center, Pimpri, Pune. She is a faculty member at International Academy of Ayurveda. Our chairperson and co-chairperson, they both brings a wealth of experience, expertise, and passion to their profession. Their dedication and vision are sure to make a meaningful and lasting impact in their field, inspiring and uplifting those around them also. I would now request our co-chairperson, Dr. Pradnya Shirke ma'am, to take over the session forward and introduce our talented speaker, Dr. Swati Mohite ma'am. Dr. Pradnya Shirke ma'am, kindly unmute yourself.
Yes. Am I audible, Simala madam?
Yes, yes.
Okay. Good afternoon, everybody. First of all, I would like to take this opportunity to congratulate NIMA Women's Forum Maharashtra State Branch for organizing such a knowledgeable and knowledge boosting webinar. Today, as a co-chairperson, I have got the opportunity to introduce our today's eminent speaker, gynecologist, a stalwart in today's topic, Uttarbasti, Dr. Swati Mohite madam. Welcome, Dr. Swati madam. Kindly accept our warm welcome on the behalf of NIMA Women's Forum Maharashtra State Branch. So I have the responsibility to introduce Madam. Where I got the biodata of Madam, it was like a booklet, but because of time constraint, I have compressed it and I have made sure. So Dr. Swati Mohite madam. Madam is MS in Prasuti Tantra Sriro, BA Sanskrit, D Farm MD IV. Madam is professor and HOD at Bharati Vidyapit College of Ayurveda Pune in Srirog Prasuti Tantra department. She is practicing as consultant gynecologist at Silver Nursing Home, Nare Ambegaon, Pune. Madam has a huge experience of 28 years of an academician as well as clinician. She has been guiding many postgraduate students. To her credit, she has numerous publications of research papers in international and national journals on various gynecological topics like PCOS, infertility, habitual abortions, and many more. Madam has delivered speeches on various topics in international, national conferences and CMEs for interns, practitioners in ROTP and ROTP for teachers. Madam has shared her research internationally also through various paper presentations. She has delivered lectures in Ayurveda conferences at Netherlands, USA, Tel Aviv University, Israel, and Zurich in Switzerland. She had been a principal investigator in clinical trials for renowned pharmaceutical companies like Phytopharma Private Limited, Baidyanath, Ayurveda Sanshadhanalaya, and also in many ICMR research projects. While giving her best in academics and clinical work, Madam is actively involved in other administrative work such as she was subject expert for syllabus reformation organized by NCISM. She is a co-chairman for NABH, member of board studies, member of board of faculty, VC nominated expert faculty for homeopathy faculty, chairman grievance redressal cell, member of discipline committee. Madam has honored with several esteemed awards like Dhanvantari Award by Badanath, Best Teacher Research Paper Award, Sanman Puraskar by Pune City Doctor Cell, Best Teacher Award by Ayurvedic Teachers Association. In spite of her tremendous busy schedule, Madam remains engaged in charitable activities in collaboration with multiple NGOs like Akanksha, Shakti for social cause as well as women health awareness and empowerment programs. So this was a brief introduction of Dr. Swati Madam, and I would like to request Dr. Swati Madam to start her session. Before starting the session, I will request audience to mute yourself, please, and let's not get disturbed our lecture. Swati Madam, please start.
If you have questions, please use the chat box and we will do our best to address them during Q&A sessions.
Now, I will share my PPT now. Okay. Can you see the PPTs?
Yes, ma'am.
Yes, ma'am, it's clear.
So now I am putting that on. Is it okay now?
Yes, ma'am. Yes.
Yes, I will move the PPT, see whether you can see it or not.
Yeah.
Can you see?
Yes, we can.
Second PPT, okay. So now I will start and thank you NIMA Forum for inviting me to share my actually clinical experience with you all. The actually basic, aim of delivering my lecture or sharing my thoughts regarding patients, so that you should continue the work, whatever I am doing little bit. So you have to contribute in my work. So that is the main intention of sharing my all thoughts with you all. So now I am having 30 years of long clinical experience, almost 400 to 700 patients a month, many, labor experience and all. Now I want you all to continue my work, because in next 5-10 years, I'm going to get retired, but my 30 years teaching experience will remain with you all. So thank you NIMA Forum for giving me the opportunity to share my views with you all. So my today's topic is Vandhatwa and Uttarbasti. I know there are many controversies about Uttarbasti, but I am the person who strongly recommend the Uttarbasti, and not Uttarbasti means not the vaginal douche, but it is a intrauterine installation. Few years back, I got the opportunity at Modern Science Forum, Family Planning Forum, Family Health Planning Forum in Hyderabad. And actually they asked me to, fill the gaps between, because that was infertility conference for modern science gynecologists. And from Ayurveda, they invited me to, the topic was that how the success of IVF should be improved. Is there any Ayurvedic modalities to improve the success of IVF? So at that time, I actually presented Uttarbasti, but not that I have not used the term Uttarbasti, but I have used the term that intrauterine lipid installation. So that is the modernization of Uttarbasti. And now in next few slides, I'm going to explain you why I selected that title. Now, for every gynecologist, almost all, I think 117, 127 participants are there from various parts of India. For every gynecologist, three qualities every gynecologist must have, and 3 supportive mechanisms you must have. First, you must have the support of the nature, because irregular menstrual cycle, you have to make it regular, and so many times we have to need the support of nature. Even we have to be very timely. So we have very few time period to treat a patient, because patient is always in hurry ki nahi, we want to have pregnancy next 1 year, next 3 months, we waited for 10 years, 5 years, 2 years. So we have time constraints also. And the last quality every gynecologist must have, that is patience. We must have patience. If we become an impatient, then cesarean section increases. The indication of doing cesarean section become the 5 p.m. is the indication of indication of cesarean section. So we need patience. Lot of patience every gynecologist need. So we write on our paper, that is wait and watch, W by W. So wait and watch, we need to have to, for us also, we have to wait and watch always. So this is very famous Bulgarian proverb. Now, I will not explain detail the things, but to understand the concept, I have prepared 2-3 simple basic slides. Just see the slide, you will get to know what are the essential factors for the pregnancy. So these are the 4 essential factors we all know. I will not go through that. Now, just a minute, I need to take this bar downwards. Yes. So what is Vandhatwa? Classically, we all know that yasya garbhashaya marga rupa bandhanam sapyati savadhya. So the woman in whom any kind of obstruction in normal process of conception is Vandhatwa. Vandhya, the word means fruitless, barren, you all know that. Even one more definition is that Vandhya nashtartava vidya. Here, the word artho can be used for both the things, that menstrual flow and ovum. The woman who has lost her menstruation and ovulation, that is also called as Vandhya. Yeah. So,
Mohite ma'am.
yes.
Sorry. Yeah, Dr. Rupali here. Ma'am, your slides are not being seen. That's not scrolled up.
No, actually, I am on the 3rd slide now.
Right now, it's only first. Yeah.
Oh. So what to do? Organizers, tell me. I can see it going forward, but you cannot. So tell me what to do.
Now we are seeing what is infertility anyway. This slide is going
Correct.
on.
This slide is there. Correct.
Yeah.
You're right.
Yeah.
Ma'am, please, can you make it a full screen?
Yeah, I have made the screen full.
No, ma'am, it's not full. We are able to see all your...
Now it is full screen in front of me.
There is one There is one cross button, one square and one minus. So you go for that cross square button to maximize the screen.
Yeah, I have already done.
Okay.
I can, in front of me, the screen is full. Now I cannot scroll the.
Okay, ma'am. Okay.
Okay. Can you see it now?
Yes, it is incidences.
Yes. Okay. Now, what are the incidences? Incidences, you all know. I will not go through this slide very much in detail. But male factors are there. Sometimes female factors, and sometimes all male factor and female factors are normal. But then it is called as unexplained infertility. Now, this is the definition of World Health Organization, that 8 to 10% couples do experience some form of infertility. On the worldwide scale, this means that 50 to 80 million people are infertile. Yes. So what are the causative factors? This is very, very important to understand. This slide is very important because patient comes in front of us with modern diagnosis. We have to interpret those diagnoses into, our basic principle. That is always a crucial task in front of us. So I have tried to, interpret the modern science causative factor into Rutu Kshetra Ambu Bijanam factors, whatever essential factors for the pregnancy. So ovulatory factor, it can be called as all essential factors are affected. If there is ovulatory dysfunction, you have to think about Rutu, Kshetra, Ambu, Bij, all 4 factors gets affected. If there is diminished ovarian reserve, AMH is very less, then you have to consider all 4 factors. If endometriosis is there, then you have to consider about the Rutu and Kshetra gets affected. If uterine factor is there and tubal factor is there, then the Kshetra gets affected. Because, if patient is having tubal block and you are giving systemic, oral medication, sometimes we need to start local treatment, that is Sthanik Chikitsa. So we have to understand how to interpret these major causes into Rutu, Kshetra, Ambu, Bij, Vikruti. So that is, if we understand this basic concept, then it becomes easy for us to treat the patient. And the last, very important, almost 10 to 25% cases are of unexplained infertility. That is because of Dhatu Sarata and Vata vitiation that we are supposed to think about. Because modern science people, whenever there is unexplained infertility, they ask the patient to go for IUI, to go for IVF. So as a Ayurvedic gynecologist, we must understand that what is the how to interpret unexplained infertility into dosha dhatu mala siddhanta. Now, what is the probable samprapti? You have to think about 2 types of samprapti, whether it is
Slides are not moving. Slides not moving.
Santarpanotta or Apatarpanotta. Can you see slides?
Slide is on incidences only, madam.
Or is on
Incidences. Male factors, female factors. Yeah. Now it is probable samprapti.
Yeah. Why it is happening, I don't know.
Ma'am, just rotate your mobile, madam, so that it will become full screen. Then you can scroll one slide after one slide, ma'am.
No, I am on laptop, not on mobile.
Okay, madam.
And slideshow.
Can you see the slide now? Probable samprapti.
Slideshow mode like you have to
Yes, ma'am. Probable samprapti is visual.
Yes. So in probable samprapti, basically we have to find out that in that infertility couple, if the male factor is there, you have to consider the male infertility. If female factor is, now today we are talking about the female infertility. So we have to see whether that the causes are because of santarpan or apatarpan. Because if the santarpan is there, our line of treatment changes. If apatarpan is there, our line of treatment changes. If santarpanottava hetu are there, then Kafadushti, Agni Mandya, Ama formation, Kafadushti. So this samprapti everyone knows. I will not go in detail of that samprapti. Now what we are supposed to do? We have to think about the present complaint. We have to, before going for the diagnosis, we have to understand the dosha dhatu mala involvement, and on the basis of that, the management, the building the treatment pillar should be done. Now, history of intrauterine approach for treatment. That is very interesting. Ayurveda literature mentions intrauterine approach of management that is around 2nd to 6th century. In modern science literature, the intrauterine device discovered in 1909, that is Richard Richer, and in 1920, that is Ernest Grafenberg. He actually, in early 19th century, modern science people understand that there is an intrauterine approach for the treatment of various kind of diseases. In 9th November 1992, a new route of drug administration of intrauterine delivery of insulin and calcitonin by Golam and Avroff Hoffman is, they both actually discovered, said that there is a intrauterine absorption, means intrauterine epithelial layer has some absorption capacity of insulin and calcitonin. These are the references where we get to know that modern science, modern medicine discovered or mentioned this route early in 19th century, but in Ayurveda it is mentioned almost 2nd to 6th century. Now, the first published paper on actual IUD, intrauterine device insertions, was made by Dr. Richard in 909. In the mid of 920, Grafenberg actually the silkworm gut with coiled metal ring made of an alloy of copper, nickel, and zinc. That is the history, and the published paper in 1993. See, this is the published paper, but we get the reference. Hello? Hello?
Madam Bharti, please mute.
Madam,
Yes.
slides are not moving again.
Can I continue?
Yes, ma'am, but slides are not moving.
So what to do? Tell me. Because slides are moving. Now, can you see the slides?
Yes, ma'am.
Now it has changed.
Then I will not put that on the, full screen. I will make like this only. If it is visible, then I will keep like that only.
It's okay, no problem.
That is the route, because if I put that on the full screen, then it becomes invisible.
Now it's okay.
Is it okay?
Ma'am, we are not able to see you. You can start your video if you wish to. You can start your own video if you wish. Yeah, now it's okay.
Okay. And the published papers about intrauterine delivery of insulin is done in 1993. So late it has been done. It can be concluded that the intrauterine administration of both insulin and calcitonin is. So these are the modern science references of intrauterine administration of drug. What I want to conclude. Now, what is Uttarbasti? Uttar Marga Diya Manata, you know this slok. I will not read this slok, but Uttar means given in the upper passage, that is urinary or vaginal. Than the usual passage, that is anal or anal passage. It is Uttar means superior in quality. It is considered as Anuvasan Basti as doing oleation or unction. Some considers as Niruha as doing cleaning. But in my view, Anuvasan is the best interpretation of Uttarbasti. This is my view. You may have the different view. Okay. What is Basti? Basti is main chikitsa of Vata Viseshan. We all know. It covers Buddha Basti, administration in the rectum, Mutra Marga Basti, administration in bladder, Uttar Basti, administration in uterine cavity. Other form of Basti as Sthanik Chikitsa, that is Kati Basti. So these are the various Bastis which we know. And Uttarbasti, nahi vata drute yoni vyapada. So basic cause of all disorders in women are yoni vyapad is all disorders called as yoni vyapad, they are because of vata visheshan. That we must understand. So whenever we want to start a treatment of any gynecological disorder, we have to consider the vata first and then the remaining dosha and dhatu and mala. So Basti is main chikitsa of vata visheshan. So Uttarbasti, administration in uterine cavity. So various opinions are of about Uttarbasti are that cervical irrigation is Uttarbasti, vaginal douche is also Uttarbasti, but no, in my view, intrauterine instillation, intrauterine, that is putting the medicine in the uterine cavity, putting the ghee or oil or whatever you want, that is in the uterine cavity, which is almost 6 to 7 centimeter long, having the capacity of around 7 to 10 cc only. That is the portion where it is to be given. Cervical irrigation is not Uttarbasti. Vaginal douche is not Uttarbasti. External parisection at vulva is not Uttarbasti, because many practices are going on that under the name of Uttarbasti. And then patient comes to us, they charge 4,000 rupees for the Uttarbasti and all. And what they did, we all know as a gynecologist. Here in Maharashtra, we come across these kind of practices and we always condemn that cervical irrigation, vaginal douche is not a Uttarbasti. So we must understand that Uttarbasti means intrauterine instillation. Now, this is the diagrammatic representation. That is, Uttara Marga means bladder, Uttara Marga means uterus, tube to instillation of drug and uterine cavity. So this is the actually Uttar Marga. This is the Uttar Marga, not this is the Uttar Marga. Rectum, routine route of Basti. So this is the diagrammatic presentation of Uttarbasti. Now, what are the indications of Uttarbasti? What are the indications? Basti rogeshu narena, yoni garbhashayeshu cha, yoni vibhrangusha shuleshu, yoni vyapad asrugdare. So in modern terms, we can interpret that as in dysmenorrhea, it can be given, in menorrhagia, it can be given, in dysfunctional uterine bleeding, pain management. Acharya Charka says that due to suppression of Vayu by Uttarbasti, yoni retains garbha immediately and woman conceives. So this is very important. And what is happening in ART, artificial reproductive techniques? What is happening? What are the major cause? What is the main cause of ART failure? That is implantation failure. And here Charka clearly says that garbha yoni retains the garbha. Retaining means what? That is, retaining is nothing but the implantation. Even if there is conception, even if you choose good ovum, good sperm, good embryo, but at the end of the day, uterus has to accept it. Uterus has to liberate some cytokinins. Uterus has to give some the signals to accept the embryo or the fetus. So that is very important. So Uttarbasti is very much useful in the failure. If patient comes to us with the ART failure, IUI failure, first we have to think about the Uttarbasti. Now, what is my clinical experience that I'm going to share with you all? That is tubal diseases, unexplained infertility, uterine synechia also I have treated with Uttarbasti, then oligomenorrhea, uterine multiple fibroids, dysmenorrhea and menorrhagia. Here, these are some areas where I am practicing Uttarbasti in my day-to-day practice. Now, whether the researches are supporting our indications, we will go through that. So there are many researches which supports the concept of Uttarbasti, which is very, very important. Because, we are practicing in the area where modern science people are practicing just next to our clinic. And patient goes there, again comes to our clinic, patient again goes there. And, there should be a very good, interaction between them and us. So if you want to interact about the Uttarbasti with the modern science people, we have to take the help of the researches done by the modern science people. they understand their language. We all, for 153 people, we understand our language. What is vata, pitta, kapha, agruta. But instead of gruta, if you use the term lipids, they understand it very easily. So many times Uttarbasti is questioned not only by Ayurveda people, but modern science people also. So here, henceforth, I am going to show some, all, my clinical experience, which are supported by the modern science researchers. So we will go with hand in hand with some researchers and some my clinical experience. So we all claim that tubal block is solved with the help of Uttarbasti. Out of 154 people, almost 90 doctors, not 90 Ayurveda gynecologists, they claim that we are treating tubal blocks with Uttarbasti. Now, what are tubal blocks? Tubal blocks are the spasms. And modern science people, they are saying that essential oils and their constituents have antispasmodic effect. So when we are claiming that tubal block is released after giving the Uttarbasti, so whenever we are treating tubal block, keep the record of tubal block before Uttarbasti, after 3 months of Uttarbasti. Because why 3 months? Because Charaka has said that gynecological diseases should be treated at least for 3 cycles. So that is the minimal requirement, minimum duration for treatment of the gynecological disorders. Infertility is one of them, and tubal block is one of the major cause of the infertility. So this is one of the research which is supporting that if you are using you are opening the spasms, then oils have that capacity to release the spasm. And what we are going, this is related to the skin. They are applying the oil on the skin. We are putting the oil in the uterus. That means the uterine endometrial cells, they are absorbing that oil or that ghee, means the lipids, and they are acting as a antispasmodic. So tubal blocks gets opened. Now these are I have many patients which I have treated for tubal block, and I always used to keep the reports before starting of the Uttarbasti and after completing 3 cycles of the Uttarbasti. So these are only just 2 patients report before treatment and after treatment. These are both tubal blocks before treatment, and both tubes are open after treatment. You can see the dates, you can see the name of the patient also. So this is of the one patient. Again, in the same here, this is the distal block. You can see this is the first photo is of distal block, and this is treated. Now this is the corneal block. You can see the corneal block, and which is treated. So many times we think that corneal block doesn't get treated. Sometimes we say that the block in between mid segment block or the femoral end block, they cannot be treated, but we can treat it very well. I have many patients. I have a lot of clinical experience regarding Uttarbasti in tubal block. So these are a few examples how I treated, and I have kept before report, HSG report of before treatment and after treatment. Yes. So what is unexplained infertility? Even we all are treating unexplained infertility with the help of Uttarbasti. But here I am going to put some different point regarding the unexplained infertility. That is, what is unexplained infertility? When infertile couples or individuals have undergone all appropriate tests. So before labeling the unexplained infertility, you must have all basic reports in your hand, and you label that as an unexplained infertility, because many times it happens that many Vaidyas, they see the nadi and they tell the patient that there is no any cause of not conceiving. I will give you some medicines, and you will get conceived. I have treated so many patients like that which were labeled by traditional Vaidyas as unexplained infertility without any investigations, and after trying 2 years, 3 years, then patient comes to, goes to other gynecologist, actually gynecologist. Otherwise, MS gynec people, other than MS gynec people, they treat infertility largely. But then the lacuna remains that they don't take care of all these things, and then patient thinks that Ayurveda is not effective for infertility. So the famous quote that Shastram Salilam. So in which hand Shastra is there? So the hand will not be blamed, but the Shastra will be blamed. So we should take care of that we should not get temptation to while doing hysterectomy, I do appendicectomy. Don't get tempted. If you want to do hysterectomy and appendicectomy, keep a general surgeon standby. You do it, but keep the general surgeon standby and do appendicectomy. So there are some basic principles which are followed by modern science people very strictly. They are very, focused that I am gynecologist, I am not going to do this. I am MD medicine, I am not going to do this. I am pediatrician, I am not going to treat the patient who is 18 years old. So we should also be very, focused and very disciplined and very ethically, very clear that we should not attempt to do those kind of practice. This is my clinical experience that I am treating many patients, because people don't know that whether we are from Ayurveda or from allopathy. They know that Dr. Mohite is treating infertility very correctly. They come to my clinic and they used to tell me, ma'am, we have taken Ayurvedic treatment for 3 years, but there is no effect of Ayurvedic treatment. And now we want treatment from you. This is happening everywhere. So don't do that. We should avoid that in our day-to-day practice. And even we should encourage our colleagues to do the ethical practice. This is my message to you all. After 30 years of and at this age, after crossing 50, I definitely have that right to tell everyone that please don't interfere in other, areas where you are not legally protected. If I am doing Panchakarma, I am MS Gynec and I am doing Panchakarma, and if something goes wrong, the case will go against me. So we must have that concept very clear in our mind. We will be definitely punished. If you are gynecologist doing hysterectomy and you did, appendicectomy, something goes wrong, patient goes into septicemia, patient needs ICU, there is lot of complications, then the legally you are not protected for doing the appendicectomy. So this is very important. I am emphasizing this point because in my day-to-day practice, I am facing this problem a lot. ANC people comes and they take treatment from some, thyroid practitioner from Ayurveda. They continue Kanchanar Gugul, Triphala Gugul, Lagumalini Vasanta, Arogyavardhini, and they says that no, now you are conceived, continue the same medicines. Don't do that. Think about Arogyavardhini twice. Think about Kanchanar Gugul. You are giving Lekhan. There will be Lekhan action on fetus also, on liquor also. So we are supposed to be very clear about our practice. So the conclusion is that whenever we are treating unexplained infertility, make it sure that you have all reports normal in front of you. About 15% of infertile couple are diagnosed with unexplained infertility, also referred to as the idiopathic infertility. Now, Ayurveda researchers claim that after Uttarbasti, woman with unexplained infertility conceives. We all claims. Now, modern science people call us, ma'am, what you did, how you are claiming that because of your treatment that unexplained infertility patient conceived? Can you explain us? Sometimes they are very polite. They politely asked us. Sometimes मजा लेने के लिए भी हमसे फोन पे बात करते हैं कि ऐसा क्या है आयुर्वेद में कि जो आप अनएक्सप्लेन इंफर्टिलिटी पेशेंट ट्रीट कैसे है, ऐसा हमारे पेशेंट ने आके हमको बताया. तो वो मजा लेने के लिए भी बोलते हैं. बट यू शुड बी इनफ कॉन्फिडेंट दैट यस, unexplained infertility can be treated by Uttarbasti. So there I am going to show you few researches which are supporting the Uttarbasti. Now what these researches are suggesting? There is one research done in China, that is fertility enhancing effect of oil-based contrast agents during hysterosalpingography and the variation of this effect within a 3-year follow-up period of infertile patients. The HSG procedure with oil-based contrast, just here is very, very clearly, try to read it very clearly, that HSG procedure with oil-based contrast agents shows a fertility enhancing effect. You all know that how HSG is done. Just 40-50 seconds, that oil-based dye remains in the uterus and it goes in the abdomen through fallopian tube. Hardly 30 to 40 seconds. We forcefully push the HSG dye, oil-based dye, and that is the end point of the procedure. But what they are claiming, see, the HSG procedure with oil-based contrast agents shows a fertility enhancing effect when compared to water-based contrast agent. And what we are doing in the Uttarbasti for infertility, we are using oils, we are using lipids, we are using ghee. Why I am using the term lipid? Because ghees are lipids, oils are lipids. So we are using oils, and this improvement could last. See again, we claim that हमने three cycle Uttarbasti दिया है, and next 6 to 8 months में patient conceive हो गया. Now this second sentence is supporting your claim that after giving Uttarbasti for 3 months, my patient conceived after 3 months later, 6 months later, 8 months later. So this second sentence supports your claim that this improvement could last at least 1 year while dropping to the normal level within the subsequent 2 years. So they are claiming that 30-second oil instillation in the uterus enhances the fertility, not even enhances the fertility, but that fertility, enhancing of the fertility remains for 1 year. So whatever we are claiming is based on this research. Now again, is this research supports Uttarbasti in unexplained infertility? See, oil-based contrast during hysterosalpingography in women with proven tubal patency. So why proven tubal patency? We all must have the reports of pre-Uttarbasti where the X-ray report of HSG before Uttarbasti showing that there is tubal block at any point. It may be corneal block, it may be mid-segment block, it may be femoral end block, end point block. So we must have previous and after report to claim our, whatever claims we have. This is the total. There were 18 pregnancies in the oil group and 14 pregnancies in the control group. Mean time to achieve pregnancy was shorter in the oil group, that is 3 to 8 months, 3.8 months in the oil group compared to 6.1 months in the control group. There was a clinical meaningful improvement in pregnancy rates between the oil group and the control group in 1 month post procedure. Correct? Again, this research is supporting Uttarbasti in unexplained infertility. Now, the second very important, research supporting your Uttarbasti, that is not our Uttarbasti, that lipidome of endometrial fluid differs between implantative and non-implantative IVF cycles. The altered lipid levels may impair endometrial receptivity and early embryo implantation. Fatty acids oxidation plays an important role in embryo development in mice and in implantation and endometrial stromal cell decidualization in both mice and humans. So again, lipid levels are very important for the implantation. So if patient is coming to you with IVF failure, IUI failure, specifically IUI failure, okay, the phenomenon or the Samprapti Bhanga will be different in you are giving Uttarbasti in IUI failure patient. But if you are giving Uttarbasti in IVF failure patient, you definitely can claim that it is because of altered lipid levels in the endometrial epithelium. Now, what is receptivity? What is receptivity? Receptivity is nothing but a kapha and vata karya. Kapha and vata, they combine together. Kapha gives the stability to the embryo, and vata is sending the uterine signals toward that embryo to accept that embryo. So this is very important. So what we are doing in Uttarbasti, we are improving, we are restoring the altered lipid levels in the endometrium. So we are restoring the lipid levels. This is very important to understand. Now, why these lipid levels get altered? These lipid levels get altered because of repeated ovarian stimulation. And because of ovarian stimulation, there is thinning of the side effect of ovarian drugs which are used for the ovarian stimulation, the drugs which are used for the follicular rupture, they all have side effects of thinning the endometrium. Okay, the endometrium becomes thin. What is thinning of endometrium in terms of Ayurveda principles? That is kapha kshay and vata vruddhi, pitta kshay, vata vruddhi. So thinning of endometrium is altered by the lipids, and whatever we are giving in Uttarbasti, those are lipids. Now, medicated oils and ghees, what are lipid soluble drugs? Medicated ghees and oils, cell membrane is lipid. So lipid soluble drugs diffuse most rapidly. This is the quote. This is the reference from the drug absorption. So what we are doing? Cell membrane is lipoid. The cell membrane, the outer layer of the cell is lipoid. So lipid soluble drugs diffuse most rapidly. So what are oils and ghees? Oils are lipid soluble extraction of the herb. So whatever herbs are having lipid soluble lipid soluble chemicals, they get extracted in the oils, they get extracted in the ghee. So lipid soluble chemicals from the herbs, they get actually, we are extracting those chemicals in the oils and ghee, that is medicated oil and ghee. And if the lipid soluble drugs diffuse most rapidly in the cell membrane. So endometrium is also a cell, endothelial cell, epithelial cell. The lipids get more nicely absorbed in the cell. Now this is one few more information regarding lipids. Fats and oils are the most abundant lipids in nature. They provide energy for living organism, insulate body organs, and transport fat soluble vitamins through the blood. Now, whenever we are using zinc, Laghumalini Vasanta, for implantation failure, so if we have treated a patient with Uttarbasti followed with Laghumalini Vasanta, that zinc, whatever we are giving, that zinc, that will get well absorbed in the endometrial epithelium, because after lipid installation, the soluble vitamins, they get absorbed very nicely. So if we are claiming that Laghumalini Vasanta is given followed with Uttarbasti for the implantation, that is the correct thinking on the basis of modern science researches. Ghee, known as clarified butter or anhydrous milk fat, is a fat-rich dairy product. Ghee is characterized by a content of 99.6 lipids and 0.3 moisture. Lipidomics as an emerging tool to predict endometrial receptivity. Again, this is one of the research, latest research, which is actually, modern science people, modern science infertilologists or gynecologists, they are struggling with the endometrial preparation during the IVF cycles and IUI cycles, ICSI cycles. But now the latest research, they are researchers, they are saying that lipidomics, lipid levels in the endometrium predicts the endometrial receptivity. So what we are doing by Uttarbasti, we are improving the endometrial receptivity or to accept that embryo, to accept that fetus. So these are the latest researches. In recent years, several studies in animal models have shown the importance of lipids at the time of embryo implantation. Now, how we can see that how we can interpret the action of Uttarbasti? It improves local production of signaling molecules, including cytokinins, growth factors, homeobox transcription factor, lipid mediators, then morphogenes, cell adhesion molecules in glandular secretory endometrium. So how Uttarbasti is improving? Uttarbasti having this action. Then changes pH of the uterine fluid, reduces thickness. If the thickened endometrium is there, even it reduces the thickened endometrium. Now, what are my protocols that I'm going to share with you all? Because you are waiting for, you all are waiting for this, I know. But to understand the concept, to we are working in area where we have 11 storied hospital, just a step ahead to my hospital. Almost 30 gynecologists, faculty, few faculty on panel, they all are almost 28 to 30 faculty working there in modern science, medical college and medical hospital. Now, I get many times a call that, ma'am, what you are doing for this, what you are doing for that, because, patients are the good mediators. They go there, they come back here, they again go there. And, they used to tell things from their side to us and from our side to them. So I want you all to be enough confident. And, even if we get a call from modern science people, you should be enough, we must have enough knowledge to explain them that how Uttarbasti works. And if we can explain them, we can see, we are showing the results. But all things come at the point that the mode of action is not known of Ayurvedic medicines. Mode of action is not known. You are proving our action. So come to conclusion that modern science researchers are proving our action. No need to prove our action. Their researchers are supporting our action. Okay. So what is my protocol? I used to give pre-Uttarbasti preparation, 2 or 3 Asthapan Basti. Okay. Then during Artavakal or Rutukal, after 5 days of cessation of menstrual cycle, 8th, 9th and 10th days. Why? Because uterus is free from covering and orifices are open. So proper ovulation of endometrium can be achieved. Now what and why? Premenstrual day, post-menstrual day, 5th Asthapan Basti. It will change. See, the last column is very important. It will change according to the cause of the infertility. It will not remain, the medicine will not remain Same in all kinds of, causes of infertility. For example, Ksaratel will not be, okay, Ksaratel will open the tubes after Uttarbasti in case of tubal block. But Charka clearly gave us the guideline that Ksharas are contraindicated for the use in reproductive system. So Kshara should be avoided. Okay, why you want to open the tubal block? You want to open the tubal block to get the conception. Kshar will do the lekhan of endometrium also. So select a oil which will open the tube but simultaneously restore the endometrium. There will be no harm to the endometrium because you want implantation also at the end of your treatment. So the medicine will change. Protocol, this is the protocol, but medicine will change according to the cause. Then 6 and 7 days, Pichu placing, that is Pichu medicated oil tampon in the vagina. 8th, 9th and 10th day, that is Uttarbasti, that is intrauterine instillation should be done. Now, again, post-menstrual, the treatment should start not directly from the Uttarbasti, because, after reading Balaji Tambe's books or Balaji Tambe's write-ups in the Sakal, patient comes to us. We read it in the Balaji Tambe, in that, article that you have to take Uttarbasti if you have infertility. So we came here for the Uttarbasti. We just want only Uttarbasti. Always remember, Ayurveda, for any panchakarma, any karma, there is a prescribed preparation given in our text. Even if we are practicing this and patient is insisting this, you should be quite enough, good in counseling, good, must have very good confidence that no, direct Uttarbasti is not effective. Because this type of cases also comes to me, that we went to so and so doctor, Ayurved doctor, they gave us Uttarbasti for 3 months, and still 1 year we are waiting and we did not conceive. Why you are tempting to give direct Uttarbasti to the patient? I used to ask patient that, okay, before Uttarbasti, have they done anything? No, ma'am, they called us on 5th day and they directly gave us the Uttarbasti. This is not the Ayurved concept. Ayurved concept is always preparation for any karma. I used to tell my patient one example. What is the ovulation induction? Without, sometimes patient goes to, for the treatment of infertility, they give the induction drugs and they start induction. I used to tell them, chalo, theek hai. See, if I ask you to run a 100-meter race tomorrow morning, is it possible? No. When it will be possible? If you practice for 2 months, 3 months, or 3 months, 2 months, 1 month, 2 months, 3 months, and then you participate in that competition for running of the 100 meters, then there are possibilities of winning. But if you are not doing anything, directly you are going and taking part in the race, that is not possible. So this is the same concept with our treatment also. All of a sudden, if you start any panchakarma or any karma, you will not get any results. So you have to prepare the patient for the Uttarbasti. Now, even patient now came to your clinic for the Uttarbasti, and you are planning for the Uttarbasti, and patient is willing for the pregnancy, correct? Patient comes on the 18th day of the menstrual cycle. Then what we say, okay, we will start treatment right from today, and we will start pachan, we will start this and that, and treatment from today. But always remember, don't start any treatment mid-cycle. Ask the patient that you are trying for the conception, we will start your any Ayurvedic treatment, not even Pachan, after your menstrual cycle. Because if you give some medicine, that patient if patient miss the period, and on 8th day, 4th day, 9th day, or 10th day, she get the report of missed abortion, she will claim your medicine. Even if you give Shatavari, even if you give Lagmalini Vasanta, whatever, simple Shatavari, simple Manjishta, they claim that because of your medicine, this missed abortion happened. So in day-to-day practice, try to start any treatment infertility. Don't start any infertility treatment in the mid-cycle. Wait till her menses come. So post-menstrual 10 to 20 days, Pachan Chikitsa, then 23, 25, 27 day Basti Chikitsa, that is Basti Chikitsa, then post-menstrual, third cycle, vaginal ovulation, and then intrauterine instillation. So follow this protocol. This is very good protocol. I am actually set this protocol after, after so many years of my practice, and this is quite working protocol, so you can practice this protocol. Now, proper time for Uttarbasti, that is pre-receptive, receptive factor. So you are supposed to start it from the 5th day, 5th, 6th and 7th day, and 8th, 9th and 10th day, before starting the follicle formation. You should stop the Uttarbasti in case of infertility. If you are treating the patient for oligomenorrhea, through and through month, every after 3 days gap, you can give maximum 9 Uttarbasti for treating the oligomenorrhea. You want to treat uterine synechia, there is no limitation that anytime you can start the Uttarbasti. Even if you want to treat menorrhagia, you can start Uttarbasti at any time. But in case of infertility, we should be very cautious. We should take care that it should be started after all treatment for infertility should be started from the 5th day onwards. So confirm that there is no pregnancy and then start the treatment. Now, what are the researches done on intrauterine instillation? Now, these are some researches which are saying that does intrauterine instillation, that is intrauterine administration of drug, that is intrauterine instillation of human chorionic gonadotropin hormone before embryo transfer, correct, improve pregnancy outcome in vitro fertilization, correct. Now, conclusion, intrauterine HCG before embryo transfer significantly improves IR and resulted in better IVF outcome. So there is nothing wrong for posting the patient for Uttarbasti before sending for the IVF. So talk with the IVF practitioner practicing nearby your hospital. Call them, ma'am, we have this kind of treatment in Ayurveda, which is supported by the modern science researches. So if you want to improve the IVF rate, we can collaborate, we can work together, and we will help you to improve the outcome of IVF. So this can happen. And I have called many doctors like this, and I have been working with many doctors like this. So you also can do that. The efficacy of intrauterine instillation of granulocyte colony stimulating factor in infertile women with thin endometrium, a pilot study done in China. So intrauterine instillation of trichloroacetic acid is effective for the treatment of dysfunctional uterine bleeding. So whenever you are claiming that we are treating a patient of menorrhagia with Uttarbasti, this is the support for your claim that intrauterine instillation improves the dysfunctional uterine bleeding. Now, intrauterine instillation of autologous peripheral blood mononuclear cells increases clinical pregnancy rates in frozen thawed embryo transfer cycles of patients with repeated implantation failure. Again, whenever we are using medicated oils, we are not using plain tira tel, we are not using plain clarified butter, that is ghee, but we are using medicated. So all steroids, note my sentence, all steroids, most of the steroids, they are fat soluble. So whenever we are using shatavari oil, shatavari contains steroids which are fat soluble and which will be well absorbed in the endometrial epithelium. The ultrastructure of human endometrium is altered by administration of intrauterine levonorgestrel. Again, this is one of the research. Then intrauterine cumulus cells enhances implantation rates in women in previous implantation failure. Now, even pain management. Again, when we are saying that, yes, we are managing dysmenorrhea with Uttarbasti. Again, this is a supportive document for you, supportive research for you, that efficacy of intrauterine lignocaine instillation endometrial biopsy. So when you want to treat dysmenorrhea also, you can use Uttarbasti, which is clearly mentioned in the shloka where the Uttarbasti, I have read that shloka, correct? Now, message from above researchers, where you can use intrauterine instillation or Uttarbasti. Why I am using repeatedly intrauterine instillation, the word, because the Uttarbasti is word for these 145 people who are attending the this lecture, but remaining thousands of gynecologists, they don't understand your word of Uttarbasti, but they will definitely understand the word that intrauterine instillation and intrauterine instillation of fats, intrauterine instillation of lipids, because lipids are very important for the endometrial signaling, implantation, and everything. So ART failure, you can suggest Uttarbasti in dysmenorrhea, menorrhagia, dysfunctional uterine bleeding, and pain management. So what is the conclusion? Uttarbasti in intrauterine instillation of medicated oil and ghee. Uttarbasti is proved to be effective in various gynecological disorders. Now, these are the few cases which I have treated with Uttarbasti, and after that the patient conceived. So I want to give acknowledgement to my Guru Kulatkar sir, my Guru Dr. Dilip Gadge, Kathe madam. When she was there, she inspired me to do lot of work about Uttarbasti. I want to acknowledge her. Even Premvati Tiwari madam, I met her twice or thrice, but she also inspired me to do work on the Uttarbasti and continue the work on the Uttarbasti. Herlekar sir, who is my teacher, guide, and he also is my inspiration, who is actually encouraged me to do this work. And even the infertilologist Sanjeev Khurd sir, who actually encouraged me to work on the Uttarbasti to improve the rates, to improve the IVF failure rates. So these are few persons who gave me lot of inputs when I was working, and I am working. But why I am saying I was working, to come to some conclusion, to put something solid in front of you. They all have given me lot of inputs to do the work on Uttarbasti and female infertility. So if you have any queries, you can ask me. And thank you, NIMA team, to give me this opportunity to share my views regarding infertility and Uttarbasti. So thank you.
Thank you, madam. Thank you for such a wonderful lecture and a knowledge boosting lecture. It was really a knowledge boosting. You have thrown light on all aspects of Uttarbasti, indications, mode of action, benefits, results, and very nicely you elaborated the SOPs of Uttarbasti in detail. So thank you once again for this informative lecture. Now we have some questions in chat box. Let's discuss, madam. The question is regarding thin endometrium. The question is there any drug of choice? Am I audible, madam?
Yes, you are audible.
Yes. The question in the chat box is there any drug of choice for thin endometrium? to get triple layer endometrium?
Yes. Do you want me to answer?
Yes, madam, please.
Yes. So for this, few days back, I am working with one of the infertility clinic here in Pimpri Chinchwad area. There they invited me for, giving the speech on the endometrial preparation. And while studying and preparing notes for that lecture, I studied Garbhadhan Vidhi very in detail. So you all study Garbhadhan Vidhi first. And various dietary components mentioned in the Garbhadhan Vidhi. The main component mentioned in the Garbhadhan Vidhi and which we all are using in our day-to-day practice, that is sesame seeds. Whenever you want, see, drugs are there. I will share drugs also. But only drugs will not give you the satisfactory results. You have to work collectively on the lifestyle of the patient. Correct? This is very important. So she should avoid, waking late in the morning, because if she holding the Vegas, correct? What do you mean by holding the Vegas? Holding the Vegas means the whatever estrogen is getting to excreted from your body. If you are holding the Vegas, so from the excess estrogen gets excreted from your body through urine and stool, that they are get excreted. So if you are not, you are not passing urine and you are not doing defecation in time, then that will reabsorb estrogen, and then your body will land up into hyperestrogenic condition, and that will lead into infertility. And that hyperestrogenic condition will either thicken your endometrium or it will make your endometrium thin. So that correction you should ask to the patient. Then second very important thing, because medicines are there, but our approach should be holistic, not only on the medicines. What modern science people are doing, they are only concentrating on the medicines. We should not concentrate on the medicine. So second very important thing, ask her to improve the fat metabolism. Ask her to stop the dry food from her diet. Dry food doesn't means not only dry in nature. Whatever is paryushit anya, that is dry in nature, that will increase the vata. Vata will will make the endometrium thin. I already explained that how vata is making endometrium thin. So we start Laghumalini Vasanta continuously, 3 months, 4 months, 6 months. But conception is not there, because Hetu Sevan is there and you are giving Laghumalini Vasanta, Shatavari Siddha Doodh, Ashwagandha Siddha Doodh, to the patient, and the endometrium is not responding because you are not stopping the Nidan Sevan. So don't concentrate only on the medicine. Concentrate on her lifestyle also. Till you concentrate on the lifestyle, you will not get the results. Just store my sentence in your mind, that you will never get the results. And at the end of the day, patient will blame the Shastra. Not they will blame us that Ayurveda doctor is not treated me in a holistic approach. Correct? So correct her lifestyle. Ask her to add sesame seeds, at least 10 grams 3 times a day in her day-to-day, diet. Ask her to add fats, that is ghee, in her diet. Correct? Even if she is obese, convince her fat will never gain the weight. There are lot of speeches of Dr. Jamna Das from UK. Write it down. Dr. Jamna Das from UK. He has done lot of research on fat, or taking the fat, eating the fats. So I'll go through those talks, health talks, and come to your conclusion that fat will never interfere in the weight. Okay, so this is third aspect. And the last, medicine wise, You can start Shatavari Siddha Dugdha, you can start Ashwagandha Siddha Dugdha, you can start Laghumalini Vasanta. So these are the three basic things that you can start in her diet day to day. You can start Falagruta also. Falagruta is also, again, whatever I have explained, that lipids plays very much important role in the endometrial epithelium layer. So start Falagruta. So you can start all these medicines. Even Chandrashur, Haliyu. बरोबर आहे का मॅडम? Chandrashur म्हणजेच हळीव. Correct.
Yes.
Haliyu again are the good source of fat, and Chandrashur is Artaujanam. Here Artav, the word I am using, this Artav word for the endometrium. You want to prepare the endometrium, na? You want to prepare the adequate endometrium during the follicular stage, na? So start Chandrashur. So Haliyu, Chandrashur, sesame seeds, and Falagruta, Laghumalini Vasanta, and all Siddha Dugdha. I don't prefer giving herbs, churnas.
Yes.
I used to give Siddha oils for infertility because lipids are very important for endometrium.
Yes.
So all types of ghees and Siddha Dugdas, they will be helpful for the growth of the endometrium.
Thank you very much, madam. Many questions are regarding drug only, that you just now explained about the drug, that the treatment should be holistic and not drug focused. It should be holistic. So I think all the questions are have got answers in your this explanation. I would like to ask you, madam, have you encountered any reaction while giving Uttarbasti?
Yes. See, actually, I have developed my own method of Uttarbasti. I have my video also of Uttarbasti, how to give Uttarbasti. And that method is developed after doing lot of research, using insemination cannula, using, syringe, using infant feeding tube and all. I have used many, instruments for the intrauterine installation. But now at the end, I have concluded that if you give Uttarbasti in proper manner, then you will not face any problem. This is the first, tagline for the Uttarbasti. Yes, some problems of Uttarbasti are there. Very first problem, when you are catching the cervix, right from that point,
Yes.
right from that point, if you catch the erode cervix, then there are chances of bleeding. If you use improper infant feeding tube for the insertion, if you select the wrong day of the Uttarbasti, you will face the problem. If you will not keep the patient in the lithotomy head low position, you will face the problem. If you are not giving correct, if you give at a time 5 cc, 10 cc Uttarbasti, it will cause problem. We don't want that Uttarbasti oil to go in the abdominal cavity because there are chances of oil embolism. Okay, so pain in abdomen, cervical bleeding, then pain in abdomen after Uttarbasti, that is also possible. So everywhere I am using, if pain in abdomen is there, I use hot water bag for the hot fomentation, and very effective drug, that is Chandraprabha and Shankhavati combination. Chandraprabha almost 1 gram, Shankhavati 1 gram, stat powdered dose should be given with warm water for the pain in abdomen. For cervical bleeding, if the cervix is not healthy, you will encounter with the cervical bleeding. So don't give Uttarbasti if there is cervical erosion. So as they read in the Balaji Tambe, they come to you for the Uttarbasti. You don't want to miss your income. So we give at any cost Uttarbasti. Don't do that. Don't do that. Tell the patient that it is a very serious procedure. It should be done in the OT complex. Yes, I have seen in one patient, sudden bradycardia collapse in one patient. But at that time, I used atropine. I used atropine, IV atropine to the patient because there was a pulse, almost not recordable pulse. That one major complication I encountered. But when almost 15 years back, when we were using insemination metal cannula, but now we are using infant feeding tube. So then we don't, when patient will get pain, when you try to dilate the cervix. Cervix is open. When the pain will be there, when you try to dilate the cervix. So if you don't dilate the cervix, patient will not have pain. So use the instrument which will not dilate the cervix. So this is the basic tagline of giving the Uttarbasti. Yes, once pulseless patient was there and we have used atropine for the patient. Otherwise, mild pain, bleeding after the Uttarbasti, pain in the both flanks, sometimes shoulder pain, because when you drag the cervix, then she will get the shoulder pain. So follow my method of giving Uttarbasti. I forgot to put that video here, but you follow my method of giving Uttarbasti, you will not get, you will not encounter any complication of Uttarbasti. I am sure for that.
Yes, thank you, madam. Have you tried, madam, Uttarbasti for endometriosis?
Endometriosis, Uttarbasti, yes, I have used Uttarbasti for endometriosis, and even I know one case I treated, and that patient was, sister-in-law of one of the BMA student. Correct? 5-6 years infertility due to endometriosis and hydrosulfins. And that was the case. And for the endometriosis, according to me, you may differ from me because, not only in Ayurveda, modern science people also have difference of opinion. Don't fear saying that this is my opinion. Yes, this is my opinion. So we always think that, mera opinion is inke opinion se different hai. Yes, it is possible. So don't fear that this is my opinion. You may have different opinion. Correct? So you must have your own opinion, but keep your opinion. So this, in my view, endometriosis is due to Vata Pittatmak Vikruti. Because Vata is taking that endometrium outside the uterus. So that throwing of endometrium is always done by Vata. And the growing of endometrium, growth of that or the growing of that endometrium is by Pitta. So that is my interpretation. You may differ from that. So before giving Uttarbasti to the endometriosis patient, give premenstrual Basti. And then on very next cycle, give Uttarbasti. I have used Uttarbasti of Panchatikta Gruta in endometriosis. Used in many patients, but one patient conceived after that treating the endometriosis, correct? Endometriosis and the Kirat Tikta Vat I have given to that patient, and she had a history of 3 IVF cycles failure. After 3 Uttarbasti of Panchatikta Gruta, premenstrual Basti, Panchatikta Gruta, and then when after 3 months, she waited just for 1 month, and on very next month she posted for IVF, and that was successful in spite of endometriosis. I know that, I remember that case also. So yes, okay. Endometriosis, Panchatikta Gruta Uttarbasti I am using. You may use different Uttarbasti.
Okay, thank you, madam. And there is one question that regarding Sharatel for tubal block, we can use Sharatel. But with Sharatel, should we add on some palagrut like Snehan or anything to prevent Lekhan Karma?
No, I don't use Sharatel for tubal block.
Oh, madam.
Sharatel is used only where the patient is in not fertile age.
Okay.
Sharatel, when patient is not willing for pregnancy, family completion, out of fertile age, even not in fertile age, till 35, I don't use Sharatel. Till 40, I don't use Sharatel. till at least till 35. Don't use Ksaratel. Yes, Ksaratel is indicated in multiple fibroids,
Okay.
not in for the tubal block. I use Sahachartel. Go through the drugs of Sahachartel. Go through the Rasavirya Vipak and researches on Sahachar itself, Vanaspati Sahachar. Then you will find that why I am using Sahachartel. You also go through the chemical constituents of Sahachartel and researches done on those chemical constituents. Correct? So you will find that why I am using Sahachartel to improve the fertility along with opening the tubal block.
Yes, madam. Thank you, madam. The next question is, should we rule out tubercular salpingitis before giving Uttarbasti?
Rule out the
tuberculosis, endometrial or
yes, of course. When see tubercular salpingitis, patient doesn't have history of AKT. Patient doesn't have history of weight loss. Patient, if you suspect that there is a sudden weight loss, even patient has not taken any AKT, there is sudden weight loss, you go for first day DNC to rule out the endometrial. In those cases where you suspect,
yes,
not in all patients, not necessary in all patients.
Yes.
See, according to me, marmaghat, we all know the concept of marmaghat. Correct? So doing any invasive procedure on the reproductive system will cause marmaghat. So I avoid I avoid surgical procedures of the, if it is necessary, I definitely recommend. But till that, I try to avoid the surgical procedures to avoid, handling the uterus, cervix and all. So if it is indicated, definitely go for that. If it is not indicated, no need to go for that. Again, if she is having a tubal block due to tuberculosis, only Uttarbasti will not work. It will not work. You have to give Vaman, followed with premenstrual basti, followed with Uttarbasti. These are the Panchakarma and systemic drugs. That is very important. I remember one case which I treated for tubal block. I used to give her Sitopaladi Churna 2 gram TDS for 3 months. I gave her Sitopaladi Churna 2 gram TDS for 3 months and simultaneously Uttarbasti. After that, she patient conceived thrice. So you have not only Uttarbasti will not work. You have to combine the treatment. So we have to design a module according to the patient.
Right.
I always use the term that Ayurvedic module, not only Uttarbasti.
Yes.
Because for every patient, the cause is different, the hetus are different, her lifestyle is different, her stress factors are different. So you have to design a module for every patient, and it is always a different. Okay, Uttarbasti material may remain same for tubal block, Sahachartel, but before treating tubal block, you have to decide the module. Whether I will go for the premenstrual basti, whether I will go for the postmenstrual basti, whether I will go for the anuvasan basti, whether I will go for the, see, if you have a patient of, adhesions, laparoscopy report in front of you with tubal block and adhesions, and patient is not willing for IVF and IUI. I remember the patient which I treated in 2015, multiple adhesions with tubal block. Then what I did? I gave her Anuvasan Basti twice a week for 3 months. And in the 4th month, I gave her Uttar Basti. In next 4 months, she conceived. So you have to design a module according to the patient.
Yes.
And of course, totally that should be based on our Ayurvedic principles.
Right.
उत्तर बस्ती के लिए दोपहर को 2 बजे पेशेंट आता है, पेशेंट को घर भेज दो. It is a type of Anuvasan Basti. It should be given before 9 o'clock or after 7 o'clock in the evening. भेज दो पेशेंट को घर. Don't entertain her. नहीं मेरा ऑफिस है. I am not able to come at 9 o'clock. I will come at 11:30. Then your Uttarbasti will not work. Don't compromise with your basic principles. Yes.
Okay. Okay, madam. All the questions are answered, I think. Just wait, madam. 1 sec. I'll check. Okay, madam. Thank you very much, madam, for such a wonderful session and wonderful lecture. Thank you once again. Now, the question answer. Okay, one more question is, madam, sorry. Actually, madam, you have answered this, explained this thing. The one doctor is asking about the premenstrual protocol of Yoga Basti before giving Uttarbasti. I think you have explained in your lecture.
Yes.
You give Yoga Basti before, in previous cycle, right?
Yes, premenstrual Basti.
Yes, yes. Okay, madam. Yes, thank you.
You want
Thank
to
you,
know
madam.
my protocol? No.
No.
Okay.
Okay. Yes, thank you, madam. Now the question answer session is over. I will proceed to our today's chairperson, Dr. Rajesh Utane sir, to give remark and to say something about this lecture. Utane sir, are you there? Dr. Rajesh Utane sir? Dr. Simala? Hello?
Yeah, I am hearing you, but I don't think he is there. Let's wait. I will call him. Just a minute. Wait a minute.
Rajesh Utane sir is there.
Sir, you have to make yourself unmute.
Yeah.
Yeah, okay.
Good afternoon, all. I highly appreciate to Dr. Swati ma'am his efforts in the shedding light of the topic, today's topic of Vandhatwa and Uttarbasti. I'm very impressed. That's well explained the unexplained infertility, and also the concept of the tuberculosis and antispasmodic effect. That is also the good for the today's topic, and also the endometrial receptivity. I hope everyone has woke up today and enlightened in with their knowledge is truly integrated. When I heard her introduction, she has started. She has shared her three decades of experience as an academician, researcher, and clinician with us. Thank you for the today's knowledge feast. Also, special thanks to Dr. Kulkarni ma'am, Dr. Anushri ma'am, President of NIMA Women's Forum, Dr. Pradnya ma'am, Dr. Meenakshi ma'am, and Dr. Simala, and NIMA Women's Forum for this share. I also thanks to all participants and all my colleagues here, and also my concluding remarks. It is really appreciable for today's lecture, Dr. Swati ma'am. But so one more thing is added on this point. The HHG lipids using in last so many years, and early 90s poppy seed, that is khaskhas oil, that was used in early 90s in HHG test. It was also used in the tubal block case. Thank you for today's lecture. Thank you for everyone. Am I audible?
Yes, thank you, sir. Simala.
Yeah. Thank you, Dr. Utane sir. Thank you. Very wonderful and inspiring remarks you have given for NIMA Women's Forum. Thank you, sir, for joining us and sparing time with us. Thank you so much.
Thank you very much.
Sir, I don't know khaskhas oil.
Yeah, some poppy seed
yes.
oil. Yeah.
Okay.
It was used in early 90s.
Okay.
our speaker, Dr. Swati Mohite mam, there is one request from all of us. Everyone wants that you should share a video of Uttarbasti with them.
Yes, okay.
If it is not with you now, you can share with our secretary later on. We will share it to our groups.
Yes, okay.
Thank you, ma'am.
Thank you.
I extend my sincere gratitude to each and everyone, all delegates, students, all state and national PhDs, all practitioners, professors, organizers, and technical team. Your active involvement and enthusiasm made this webinar a tremendous success. We believe knowledge is empowerment, and your keen interest to webinar reinforces the belief. The insightful discussions, Q&A after webinar enrich the learning experience. Our special thanks to our speaker, Dr. Swati Mohite madam, who dedicated her time and expertise to share invaluable insights on the topic of Vandhatwa and Uttarbasti. And all of us had now come to know that she is the Bahubali of this subject. I sincerely acknowledge the presence of national and state PhDs. Your presence and contribution created a vibrant atmosphere, fostering networking opportunities and enhancing the exchange of knowledge. We are also thankful to technical team, Dr. Girish Daga sir, Dr. Manish Joshi sir, Dr. Shilpa Korane ma'am, and the whole team. We look forward to stay connected with you all through next session, that is session 5, which is on the role of obesity and PCOS in infertility, which will continue to promote education and awareness in the domain of women's health. I am especially thankful to Dr. Pradnya Shirke ma'am for giving me the opportunity to host this session. I would request everyone here to get registered in NIMA and also be a part of NIMA MBS scheme. Thank you once again for being an integral part of this enlightening event. Thank you, and please forgive me if I have forgotten or missed somebody's name. Thank you so much for being with us till the end. Thank you, everyone.
Thank you.
Thank you, ma'am.
Thank you, everyone.
Thank you, Rajesh sir. Thank you very much, ma'am.
Thank you everyone. Thank you NIMA Maharashtra.
आज हमारे
Chairperson.
नीमा वुमेन्स फोरम सेंट्रल प्रेसिडेंट डॉक्टर पगम मैम का बर्थडे है.
Okay.
I wish happy birthday to ma'am.
I would like to sing 2 lines.
Many happy returns of the ma'am. Unmute, ma'am. Unmute. Mute.
Mute आहे मॅम तुम्ही अनम्यूट करा.
Okay. Thank you everyone.
Many happy birthday.
बार बार दिन ये आए, बार बार आए, बार बार दिन ये आए, बार बार दिल ये गाए, तू जिए हजारों साल, ये मेरी है आरज़ू. Happy birthday to you, happy birthday to you, happy birthday to dear madam, happy birthday to you. Happy birthday, madam. Happy birthday from all of us. From all of us. It was from all of us.
It was very lovely.
Thank you, everyone. Thank you,
Good
everyone.
opportunity we got.
Yeah.
तर मॅडमच्या बर्थडेने सुरुवात झाली आणि आता मध्ये माझा बर्थडे आला नाही. करेक्ट.
Thank you, Swati ma'am. Thank you very much.
Thank you.
Yes, nice anchoring.
Simala, very good anchoring.
Thank you so much.
Very lively and.
Thank you.
Ma'am, एक request है.
Pradnya ma'am.
Please share your video.
Yes.
Most of us were demanding for madam's contact number also.
Yes.
Ma'am is not there.
Yes, ma'am.
Yeah, ma'am, you're audible.
I think
Swati
madam,
ma'am is not there.
Swati madam is left, I think.
Okay.
Yes, ma'am has left.
Okay, everyone, have a good day.
Nice
Bye.
anchoring.
Bye.
Thank you. Bye.
Simala, Pradnya, thank you.
Pradnya Shirke ma'am,
Thank you.
today we got to meet you.
Thank you, madam. Nice to meet you. First time we met.
Yes. Online
I have
meeting.
heard about you, but
Ma'am,
meeting
what
for
was
the
that
first time.
shloka she told na? Swati
Yes,
ma'am
ma'am.
told one shloka. शास्त्र बदनाम होतो.
हाँ, अगर गलत इंसान के हाथ में हो तो ऐसा.
Yes.
हाँ.
So, madam, it is recorded session. We can hear it later also.
Ah, yes.
Actually, we are
but-
not remembering.
Yes. I have to find out. Yes. Okay.
Okay. Thank you, madam. Thank you all of you for inviting me as co-chairperson, and thank you very
Our
much.
pleasure, ma'am.
Our
We will again
pleasure.
invite you.
Pradnya Shirke madam is born in Chandrapur only.
Oh, so what is it proving?
Connections in NIMA.
Yes.
Yes. Chandrapur excels in him.
So whenever neurons get connected, brain becomes more active. So now ladies are getting
Maybe,
connected.
yes.
Bhai पण भारी देवा. Now we are going to be rock.
Chandrapur Baipan is very bari.
Yes. Under the leadership of Anushri ma'am and Khose ma'am and Saratkar madam.
Thank you from.
Bye everyone. Shall I leave, ma'am?
Yes. Who will end the meeting?
Yes.
Yes.
Who will end?
I will, ma'am.